Welcome to page 23 of Anatomy Coloring Book. This is Dr. Stephen Harkins. Part 2 of the bones of the skull, just from different views here. Starting with the occipital bone once again. We know the occipital bone is this bone in the back of the skull. And it is the bone, and this is the lambdoidal suture here. And comes all the way up. It forms the occipital condyles here. And it's the back of the skull and forms the posterior cranial fossa, that portion of the skull here, as you can see, that contains the back posterior part of the brain, the occipital lobe of the brain. You can see here the posterior cranial fossa. Oops. And unique to the posterior cranial fossa, of course, or the occipital bone, is, of course, that it contains a big hole called the Foramen Magnum. The Foramen Magnum. That's what Foramen Magnum means. Foramen means hole, and magnum means big, a big hole. And what do you think travels through this big hole? But the spinal cord, or the brain stem, and the spinal cord, so that the nerves and the neurons can travel all the way down to the rest of your body through the spinal cord into your body. And here, of course, are the occipital condyles. This is the place where your spine, where your head rests. This is the bottom view, looking down. If you were to cut off the head and look up at it, upward at it, you would see these occipital condyles here, where the neck, the head rests on the neck, the first vertebra of the neck, the atlas vertebra. And of course, this view is looking down into, with it cut off, and this, there we go. Here's your view right here. And of course, this was a median or coronal, or a median section here, looking inside one half of the brain. And that is the occipital lobe, or the occipital bone. And the parietal bone, another cranial bone here, which we've discussed. There are two of them, one on each side of the head, superior to the temporal bone, and lateral to the superior and lateral to the occipital bone. And let's define that again in this view over here. Well, most of it has been cut off in this view here. So it will be something like this here. The rest of the parietal bone, as I said, most of it's been cut off. It's superior to the temporal bone. It represents most of the side of the head. Now moving on to the frontal bone, aptly named because it is in the front of the head. Here you see what is called the frontal sinus. There are actually holes in some of your cranial bones, representing their sinuses, making the bones of your head actually lighter. There's your frontal bone with the frontal sinus. And the frontal bone from the anterior view here. It is, there we go. It is the house, the home of the anterior cranial fossa and houses the frontal lobe of the brain. The anterior cranial fossa, the frontal lobe. The frontal bone. Okay, that's the frontal bone. The temporal bone is on the side of the head, posterior to the sphenoid bone, inferior to the parietal bone, superior and anterior to the occipital bone. And you can see here the zygomatic arch of the temporal bone. Or excuse me, you would not be able to see the zygomatic arch from this view. You would see that from the outer view. This is what's called the Petrus portion of the temporal bone. It's the hardest bone in the body. The Petrus Ridge. Peter, the name Peter means rock. So think of a very hard portion of the temporal bone. It's actually right here. And the internal auditory meatus. Now we're looking at the skull from the inside, from this view here. And the internal auditory meatus, in other words, the canal that sound travels through from your ears to get into your brain or to your inner ear. So this is the inside portion of the temporal bone. Temporal bone. Now we start getting into these little tiny bones. The smaller bones, the ethmoid bone. Recall that the ethmoid was a singular bone that spanned from one side of your skull to the other, similar to the sphenoid bone. And here it is here. The sphenoid, or the ethmoid bone, and it has a perpendicular portion to it, or an up and down portion, that makes up the nasal septum, the part of your nasal area that divides your nose into the right and left side, right here. So it, along with the vomer bone, is part of your nasal septum. It lies just inferior, as you can see, underneath, inferior to the frontal bone. Just posterior to the ethmoid bone, that was the ethmoid. Posterior to the ethmoid, we have the sphenoid bone. And recall, sphenoid was one of those wing-like bones that spread all the way from the right. It's a single bone that spread from the right side to the left side of the skull. The sphenoid bone. And it has a very convoluted shape here. And then takes this route here to in a sort of a bowl shape here to contain in a structure called the sella turcica of the sphenoid bone. And it contains the pituitary gland, an endocrine gland that supplies hormones for the body. The sphenoid bone also contains a sinus, big, huge hole in the middle of your skull, similar to the frontal sinus of the frontal bone. And so let's take another look at the sphenoid. And here you can see sort of its wing-like shape. You can't see all of it. The sphenoid bone from the this view here. Yeah, you can see its larger wing type shape here. Let me get rid of some of that. There we go. And here you can see the sphenoid bone is anterior to the occipital bone. And it's posterior to the frontal bone, medial to the temporal bone. The temporal bone, which lies, where is the temporal bone? Green. The temporal bone, there we go. Articulating with the temporal bone there. not to cut off the palatine bone. Let's correct that. Oops. I'll leave out the palatine bone there. There you go. Maxillary bone. And let's color that palatine in. There we go. And while we're at it, this little inferior portion of the sphenoid bone. And continuing with the maxilla. There we go. With a little bit of the inferior nasal concha protruding out there. That is the maxilla or maxillary bone. Now let's head back a little bit to the sphenoid, or let's color that. That's the maxillary bone in orange. And round it out with the sphenoid bone from the inferior portion of the skull. There we go. Sphenoid has to take the cake for the most oddly shaped bone. It has protrusions. It spreads from one side of the skull to the other and has all kinds of protrusions and wings and holes and gaps and bumps and ridges. Speaking of the bumps and gaps and holes and ridges, they are very important to know what they all represent, but let's just go through a brief discussion. We talked about the sella turcica, which is this little bowl shape here that holds the pituitary gland, the frontal sinus, the sphenoidal sinus, the Petrus Ridge, that hardened portion, the Petrus portion of the temporal bone, in the middle and internal ear. And foramen. A foramen means a hole. So wherever you see a hole, a foramen, it means a hole. And there are a lot of them in the skull. Why? Because the arteries and nerves and veins need to go to the skull to provide the brain, to get to and from the brain, to provide nutrients from the brain, blood to the brain, and to get blood out of the brain, to provide whole places for the nerves to go from the brain stem. They need to exit somewhere. The spinal cord needs to exit, etc. So let's briefly go over them. I'll use a highlighter, perhaps, to quickly discuss. The cribiform plate, this is where the olfactory nerve right here. The olfactory nerve lays down here, and the olfactory nerve for smell is allowed to, it can escape to the nose to provide input about smell to the brain. The optic canal here, obviously for cranial nerve number 2. For eyesight, the superior orbital fissure in this area for cranial nerves 3, 4, 5, and 6. Sella turcica, which we discussed as the place where the pituitary gland rests. Foramen rotundum for cranial nerve number 5, the second branch here. Foramen ovale for the third, obviously called ovale because it's oval shaped, for the third branch of the trigeminal nerve. Foramen lacerum here. Foramen spinosum for the middle meningeal artery. Internal auditory meatus for hearing. The jugular foramen. The hypoglossal canal. And then from the bottom, very difficult to see on here, the inferior orbital fissure. Actually, that's the posterior nasal aperture. The inferior orbital fissure is here and here. Again, the foramen ovale. Carotid canal for the carotid artery to pass through from the heart up to the neck and then into the skull. Foramen lacerum. And those are just a few of the foramen or holes that allow the blood vessels and nerves to go to and from the brain. And this has been page 23 of Anatomy Coloring Book, Bones of the Skull, Part 2, Dr. Stephen Harkins.